Congress is running out of time to stop a health care affordability shock. With key Affordable Care Act subsidies set to expire in just weeks, millions of Americans could see their insurance premiums surge, some more than double. Our political editor, Mark Maxwell, is monitoring how our elected officials are taking on the issue. Mark?
Yeah, today Senator Dick Durbin brought that warning home to a safety net hospital in the Metro East as Washington remains deadlocked over what comes next. He chose a medical provider that serves many of the region's most vulnerable patients as his backdrop to warn that clock is ticking fast. What happens next will shape who can afford coverage in the new year and who cannot. At this safety net hospital, the stakes of Washington's gridlock are already clear. Senator Dick Durbin says the Senate's failure to extend Affordable Care Act tax credits guarantees higher premiums for millions of Americans starting January 1st.
A small business owner from downstate Illinois wrote me, "My premiums are going from $900 a month for my family to $4,500 a month." They concluded, and we quote, "We have to go without health care in this coming new year." That's the reality of the vote yesterday.
Democrats pushed a 3-year extension of pandemic-era subsidies. Republicans countered with health savings accounts. Both plans failed, neither reaching 60 votes. Durbin says the consequences are immediate and unavoidable.
But people will face these monthly premium increases at least one time.
Early data suggest many already are. State health officials across the country report more people dropping coverage or shifting into cheaper plans with higher deductibles, warning of mounting financial strain as subsidies expire. Missouri Senator Josh Hawley was one of just 4 Republicans who voted to extend the tax credits. He's now urging party leaders to act.
I just don't know how Republicans would explain that to 24 million Americans whose premiums are going to double. We need to think about the human cost of this.
Durbin says responsibility now rests with the party in power.
If we're going to reform and change the system, that's in the hands of the Republicans. They're in the majority. They set the agenda.
The second most powerful Democrat in the Senate defended his recent decision to help Republicans reopen the government, despite no guarantee of a health care fix, just a vote. I pressed him to explain what Democrats got out of shutting the government down.
What leverage did you gain in the government shutdown?
The leverage is reality. The reality of the vote yesterday and the pain and suffering it's going to create across this country. That wasn't the end of the story as far as I'm concerned.
Durbin banking on that reality check, hoping it'll pressure Congress to do something. House leaders say they may try before the end of the year, but again, time there is short. If Congress doesn't act here, higher premiums kick in January 1st, and lawmakers return to Washington facing a health care crisis that is no longer looming, but landing hard.